Hi.
Hello,
Hi, how are you?
I'm doing well. How about you?
I'm doing good.
Good, 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 good,
We're just
good.
we just finished like literally 30 seconds ago the last session, so
Okay, so they taking a little break.
not yet, no.
Okay.
If we maybe when we there she is.
And I definitely want to take a picture when Dr. Simon gets to his first slide. I want to take a picture. So y'all know the drill by now, right?
Miss Carolyn, we're not getting pictures of you on the say
I
something.
know. It's all good.
There you go. We have to include you. Miss Carolyn is always the one behind the camera, and that's not fair because then she never gets to be the one that's in the pictures. So we want to make sure everybody gets a
It's
fair
all
share.
good.
So, okay, Dr.
We ready? Hello,
Yeah.
guys. So I guess I can say good evening for most of you all, but it's still afternoon if you're on the West Coast. So we'll do it like that. And I don't have on pajamas. I had clinic today. So anyway, good to see you guys again. And I'll say it again. I just wish that we were in person because this would be a lot more fun because I could walk around the classroom and ask questions, but it's going to be good. So you guys need to listen up because I will see you guys on Friday, and some of this will apply to the fun that we're going to have on Friday. So with that said, I am ready.
Okay. Let me share my screen here.
Okay. I'll just tell you all about our the title Tales from a Routine Eye Exam. Remember, I asked you guys to look up the Crypt Keeper the last time I talked to you all, but I decided to leave him out of it. And I named this Tales from a Routine Eye Exam because most people think that a routine eye exam is all about just glasses and contact lens. But as I stated the last time I was with you guys, the eyes are not divorced from the rest of the body. Same thing that affects the rest of the body, it affects the eyes. And to be quite honest, most of the time it manifests itself in the eyes first. So the eyes get to be a reflection of your total health. You can move on. Our objectives, I want you all to know optometry is not an isolated health profession, and the human eye plays a role in the assessment of the total health of the body, just like I said. You can move on. Now, some of this is going to be repetitious because we talked about this. There were 3 O's in vision. You had the optometrist, ophthalmologist, and the optician. I'm an optometrist. My partner here at the office is an ophthalmologist. And doctors of optometry are the independent primary healthcare professionals for the eye. Optometrists, we examine, diagnose, treat, and manage diseases, injuries, and disorders of the visual system and the associate structures. Next slide. And my partner is an ophthalmologist. He is a physician. He attended medical school. But there's a lot of interplay. We both are primary eye care providers, so we both can treat eye disease. We both can diagnose eye disease. His specialty is surgery, eye surgery. In some states, optometrists can do minor surgical procedures with the use of laser and removal of small lesions such as styes. You can keep going. Next slide. And then there's the optician. We own our own eyeglass company here, and the individual that takes the measurements, fits the glasses, and makes the glasses, that is the optician. Next slide. Before we can talk about the eye exam, we have to talk about the anatomy of the eye. And I could not assume that everybody has had anatomy, because that's never usually the case. So let's just talk about parts of the eye. Next slide, which is the lens. The lens is just like a camera lens. Matter of fact, the eye was designed, the camera was designed after the human eye. They have the same parts. That is the lens. Believe it or not, the lens is not the most anterior part of the eye. It sits behind the color part of the eye, which is the iris. And you cannot see the lens. The lens is crystal clear when we're born, and its job is to focus the image on the back of the eye. Next, click. Next is the retina. Like I said, the camera was designed after the human eye. The retina, think of the retina as like with the old time, the cameras, it is the film. It is where the image is developed and sent to the brain, and the brain says, okay, that's a tree. The optic nerve is the cable that takes the image to the brain. Next. One more. The cornea. And I know some of you all wear contact lens. The cornea is the most anterior part of the eye. It is where the contact lens sits. It is also clear, and it is also instrumental in bringing the light to a focus on the back of the eye. Now, the colored part of the eye, that is the iris. And the center of the iris is an opening that's called the pupil. Just like in a camera, the responsibility of the function of the pupil is to control the amount of light that goes into the eye. Next. So how do we see? I'm sure most of y'all could answer that, but the images we see are made up of light reflections. Say you see a tree, the light reflection of that tree comes through the eye, and the light is focused through via the lens to the retina. And the retina is really an extension of the optic nerve, and the optic nerve takes the image to the brain and to the visual cortex in the brain. Just like this image here, there's the light bulb, the reflection of light. Light goes through the cornea and the lens, and it is focused on the retina, and the retina carries it to the brain, and the brain perceives it and analyzes it, and that is an image, and it tells you what the image is. Next. So optometry helps people see better. I would be remiss not to explain what happens in the eye exam, and to include some of the most common things that we go to the eye doctor for. So in any health profession, you have to, when a patient comes in, you have to do the case history or chief complaint. Why are you here? Well, I can't see far away. I can't see at night. My eyes hurt. My eyes feel dry, etc. Then visual acuity, short is VA. That's how well you see. Next, you want to check their color vision, because color vision plays a big part in determining if there's a disease process. Just so you know, normally only guys are colorblind or color weakness, because we only have one X chromosome and a Y chromosome, and the color blindness gene is sex-linked recessive, is a recessive gene. Then we check the ocular motility, which is how well the eyes move together if there's any restrictions, looking up and down, all around, and in a figure 8. Next, we do what's called retinoscopy. Retinoscopy is the manual way to determine what the refractive areas, and the refracted areas is how much nearsighted or farsighted or astigmatism. And if you're kind of lazy, you could do an auto refraction. The computer does it for you, but I kind of like the old school way. Next, we have what's called a slit lamp exam. That is a biomicroscope where we evaluate the front of the eye. And all of these same things are done in the, whether you're an ophthalmologist or an optometrist, you would do exactly the same thing. We didn't talk about number 7, stereopsis. That's just like these earbuds, these headphones I have on. It's where the two eyes work together, where you can see depth. You can notice that an object has width, thickness, and that's depth perception. Like when you go to a movie and you put on the 3D glasses, same thing. IOP is interocular pressure, and the interocular pressure is more glaucoma testing. And glaucoma is when the eye produces too much fluid, or the way the fluid go out of the eye is there's a problem with the filtering system. Then there's the visual fields testing. It tests your peripheral vision. Next. So, let's see, is that the little puff of air? It can be the little puff of air, but we don't like it, and the patients don't enjoy that either, so we don't use that. We use there are other ways to do it. It hurts so bad. Yeah, I don't like it, and the patients don't like it, so that's why we don't use it. What part of the eye is affected that makes people not be able to see without glasses or contact? Good question. The cornea is what determines whether the length of the eye and the front of the eye determines how much nearsightedness you have. The front of the eye can be too curved, and that means that you have more nearsightedness, or the eye can be too long and you have lots of nearsightedness. And as in the picture, as you can see, the image up closer to us is clear, but the one in distance is blurred. And you have a horrible time seeing at night and actually during the day too. So we would, with nearsightedness, are corrected with what we call minus, you're welcome, minus lenses. Minus lenses make things smaller and clearer, because if you look at the picture of myopia right there, the light becomes focused right in front of the retina, and by the time it leaves that point of focus, it's enlarging again, so the image is large and blurred. So minus lenses pushes the focal point back further so it'll become focused in the right place, right on the lens. Why is it recommended that you wear sunglasses with contacts? Because wearing contacts make you more sensitive to light. Next slide. You can go to the next. Okay. This is, no, the one, go back to that hyperopia. Yes, this is hyperopia. This is farsightedness. The light focus actually behind the eye. So plus lenses magnify things and bring the focus back on to the eye. As you notice, the image is blurred up close and far away is clear. But this is also kind of the same thing that happens when you turn 40. You can have normal vision. I'm 20/15 at distance, but I have to wear reading glasses when I get ready to read. That's because the lens in the eye has gotten older, and what's called zonules, which are the muscles that causes the lens to flex, they're old. They're not, they don't function like they used to. Next slide. Now this one, I don't know why people think that this one is so bad. Oh, I have such bad astigmatism. All astigmatism is the front of the eye, which is the cornea, is generally shaped like a basketball, but it's not shaped, it's shaped more like a football. Part of the front of the eye is curved more than the other part. And if you think about it, it's like when you look at a T, the letter T, if you have astigmatism, the horizontal part of the T might be in focus and the vertical part might not be in focus. So the lens is designed to bring both in focus at the same time. Next. So optometrists, we diagnose eye conditions and diseases. So does like I said, my partner does the same thing. I have astigmatism. Okay. Go ahead. Next. Yes. Okay. This is called a cataract. Now, remember, I told you that the lens was crystal clear when you were born. As we get older, the lens becomes cloudy. So if the lens is clouded, think about if you were drinking milk out of a clear glass, and you know that film that's left after the milk is gone and you try to look through it, that is what a cataract is. It's when the lens has become cloudy. The most common types of cataracts are what's called senile cataract, and that's because the word senility means older. And you usually see that in individuals in their 60s, 70s, but you can see it earlier. And individuals that have other systemic disease such as diabetes, they have cataracts earlier. Or you can be born with a congenital cataract, or you can get it from trauma. Or as you're gonna see later on in the talk, you can get it from medication. So next. This is how you see two light towers. You see one that's really clear and the other one is hazy. That's what the individual with the cataract would see. If we were in person, we do a lab where you put on these goggles that simulate all these things that I'm talking about. So we couldn't do it, so I had to show it to you this way. Then there's strabismus, or the eyes turn, or as lay people say, let's see, does fluctuation in glucose damage the eyes more or sustain high glucose level? I'll answer that in just a second. The lay term crossed eyes. As you can see, the eye on my left is turned inward toward the nose. Can that be corrected? Yes, there are several options. My partner could do surgery on it to shorten the medial rectus muscle that's causing the eye to turn in. Or this is caused because that child is highly farsighted, and they're trying to accommodate to make up for the farsightedness such that the eye tend to turn in. To fix that, you just put on spectacle corrections or contact lens. To answer that question, does high glucose level damage the eye? Yes, it does, and you'll see later on, and it speeds up the process of cataracts. It causes a whole lot of problems. This is the retina. This is a normal retina. And where that circle is, the macula, that's where all our color vision comes from. And that's where our sharpest vision comes from. The optic nerve, that's what carries the impulse back to the brain. Okay, next slide. This is glaucoma. The nerve, you see, it looks where the vessels come out, it looks like there's no neuroretinal tissue in there. It just looks like the blood vessels are just dangling around. What happened to the macula when people are colorblind? There's not, the macula could be normal in colorblind. The macula could be totally normal. That depends on, that's a good question, because when I told you that normally males are colorblind, if that was a female that's colorblind, then yes, that's a disease. That's usually a disease process involving the macula. But in this nerve head right here, there's, we call, the center is called the cup. And the cup is should never be the size of the entire diameter of the nerve. Think of it like a donut. If the smaller the hole in the donut, there's more goodness to eat. If the hole in the donut is almost the size of the whole diameter of the donut, then that's the problem. You've lost lots of nerve fiber layers. Next slide. And this is what happens when you lose nerve fibers. It's like looking through, you have tunnel vision. This person could still be 20/20, but if you walked up to them from the side, they would not see you. What would you say is a common diagnosis for younger people eyes due to? Dr. McNichols, could you read that question, that last one?
What would you say is a common diagnosis for younger people's eyes due to the effects of screen time, phones, computers, etc.?
Well, the truth of it, you get eye fatigue, eye pain. Actually, some of them, actually, sustained near work brings about more nearsightedness. Haven't you noticed? Often everybody in my class wore glasses except me. Sustained near work, because the eyes get so used to staying locked into that up close mode. When it's time to look off at distance, it's almost like it forgets to do it, and you end up being nearsighted. Okay, next slide. To the individual that asked that question about the macula, this is a jacked up macula right here. This is macular degeneration. And I'm sure you guys have heard of macular degeneration. The fluffy white stuff is what we call exudates, and it comes from the pigment epithelial, which is behind the retina. The one where the arrow is, this is what we call wet macular degeneration, because it involves hemorrhages, and it is not a good thing. And remember, I told you the macula is where we get our best vision, but it's also your aiming. When you, for example, it's your aiming area of the eye. If you look at this, that you can't see the children, the two boys' face, because the macula is gone. And when you read a book or try to read a sentence, you would say age-related and macular would be gone, and then you would see degeneration. And it's really hard to get that vision back. The retinal specialists, which are ophthalmologists, they have become really good at helping these patients, but oftentimes there's sometimes there's not really a lot you can do. So in these cases, to prevent it, we put them on supplements, and then there are certain foods you don't need to eat, and you need to stop smoking and all that kind of thing. Actually, that image there can come from damage from the macula from other things, like trauma. Or sometimes the vitreous, which is the center of the eye, as we get older, it sort of liquefy and it's attached to the retina and it pulls away. Which is a normal phenomenon, but sometimes it takes the macula with it. But however, the retinal guys have gotten really good at making it, and it leaves a hole, and the retinal guys have gotten really good at fixing that. Next. Optometrists assist in the diagnosis of systemic problems. This is cholesterol and heart disease, especially when you got vascular problems. This individual didn't even know they had uncontrolled hypertension. But we know because we can look at the tortuosity or how squiggly the vessels are. And plus, up at the top, there is a plaque in the vessel. The vessel is, that vessel is blocked. When we were in school, one of our professors did a study, and it showed that if this wasn't attended to, they weren't referred to a primary care physician. They had like a 5-year life expectancy. Because think about it, that plaque had to come from somewhere. Like I said, the eyes are not disconnected from the rest of the body. Same blood vessels, same nerves, same everything. So it had to travel. It had to travel from somewhere. So it either traveled from the carotid arteries in the neck, or it could have traveled as far as away from the mitral valve on the heart. Next. And this is another picture of the same thing. And like I said, the origin was the carotid artery. This is another picture of uncontrolled hypertension. And you're gonna see, we're gonna talk about diabetic retinopathy, and the difference between these two is oftentimes if the blood pressure is controlled, brought under control, then all the hemorrhages and what's going on there, the vision can be restored. A little different from the diabetic retinopathy. Next. You see those little small hemorrhages? This is the beginning of diabetic retinopathy. This is an individual with diabetes. Like the first really good question that was asked, if you control your blood sugar, you can pretty much control these things from happening. There again, the eyes and the rest of the body all connected. This is the, in case you can't recognize that, this is the iris, the colored part of the eye. It is avascular. It is not supposed to have blood vessels in it. This is really bad, and this is from uncontrolled diabetes. And if you notice, most of the things that I've shown you all, it covered each part of the eye, but it goes right back to the entire body. Just like in diabetes, you have the hemorrhages, you have the cotton wool spots, and the cotton wool spots mean that the retina is dying because it's not being nourished by blood supply. It's basically suffocating. And that's when you have everything going on, cotton wools, hemorrhages, and blood vessels, new growth, blood vessels growth, you call it proliferative diabetic retinopathy. When you just have the small hemorrhages and the cotton wool spots, it's called background diabetic retinopathy. We've had people that would wake up in the middle of the night, oh, Dr. Simon, I woke up in the middle of the night and my vision was gone. And what did you do? Oh, I just laid back down as if it was gonna come back later on. They didn't come in for a month, and that was not good. So no, their vision did not come back, but that it didn't have to end like that. But it happens all the time. It would be better if a lot of these things were painful. Then they would do something about it, like your tooth. If your tooth was hurting, you would go to the dentist. Here's the same thing with diabetes, lots of hemorrhages and exudates. And however, as bad as this patient has pretty good vision because it isn't in the macula. So, next. This is what it looks like when you have diabetic retinopathy. See the little splotchiness, and you see that there are dark areas that it cannot be recouped. Once it's gone, that's the way it is. You have to live with what's residual. We want to keep it like the normal vision, and it can, but it takes cooperation. We see our diabetic patients every 6 months. Next. I know most of you all have probably heard of sickle cell disease. It's where the blood vessels are abnormal, the red blood cells are abnormal, they are shaped like sickles. And this is pretty much a disease that you see in African Americans. What you see here, the whitish image at the top is where dye has been injected in the patient, and so to follow the blood, and these bulbs that appear at the end are leakage and hemorrhages. Haven't seen but one of those in my entire career, because it's rare. Let's talk about the cornea. If you remember, the cornea is where the contact lens sits. However, it can tell us that there's a systemic issue going on also. If you look what look like the little dent that's in the cornea where it's melting away, this patient is having a drug intolerance, hydroxychloroquine, which is Plaquenil, which is used for autoimmune disease such as lupus and rheumatoid arthritis. So when I see that, I have to talk with the rheumatologist, and they consider changing the drugs or changing the dosage of the drugs for the patient. So, and these where people come in for routine eye exams, they had no idea this was going on. This one is one of my favorites. It's iritis. I started to put in the little where you could click on and a song would play. It's called This Masquerade by George Benson, because this can masquerade a lot of things could be going on. In a 10-day span, I had 5 different iritis, and they were all from different stuff. All of them were totally different. For example, an iritis is an inflammation of the colored part of the eye. It's very painful, and the patient is very sensitive to light. It could make their interocular pressure go up. It could be from undiagnosed STDs like syphilis. It could be from autoimmune disease such as sarcoidosis, lupus, rheumatoid arthritis, or it could be from trauma. Or it can be from my new friend, hepatitis C. Interesting case, young man came in and he's 26, and it just didn't look right because his dad brought him in. Who does that? And so he didn't give full disclosure. So we fixed the situation, and he comes back. I said, well, and this always works. I said, well, I give them the possible diagnosis. I said something systemic is wrong. I said, now either you have a undiagnosed syphilis, which we're gonna have to get you checked for. And so that got the blood running real good. And so, and it turns out, so he goes, we have like 12 to 14 internal medicine guys here. So he goes up and get a physical. So he comes back, things are looking much better, but he said, Dr. Simon, I said, you didn't tell me the truth, did you? He said, no, sir. He said, what I didn't tell you was I was a recovering heroin addict, and they just diagnosed me with hepatitis C. And that was the culprit, the hepatitis C. But had he not had the iritis, he never would have gone to the doctor, and he never would have found out he had hepatitis C. So you see how all it, and this is from an eye exam. You've heard of the pink eye, the one that's very contagious. In that same 10 days, I had a patient with viral conjunctivitis, which gave him this same deal, iritis. But the cool part about it, they're all treated, you treat them all the same way. So then we had one of my younger fraternity brothers came in. He had the same thing. And I said, he led me to believe that he had been around some kids that had the pink eye. I said, don't look like the pink eye. I said, well, okay, you're gonna have to go and get checked for STDs. So now he's feeling some kind of way about it. So he comes back, he's doing better. And he said, Dr. Simon, I'm sorry, I didn't give full disclosure. My girlfriend hit me in the eye. I already knew that. And you treat it the same way. So there's 4 or 5 different cases I've given you, and it's the same thing. And but the good part about it, you treat it the same way, and they get better. You treat them with corticosteroids, which have side effects, which can cause cataracts, or it can elevate the intraocular pressure. But however, the good outweigh the bad, so you can fix all those other things. All right, next slide. Here's another individual that has uncontrolled hypertension. And like I said, those white cloudy looking spaces, that's ischemia. And ischemia means loss of blood, meaning that it's not it's not getting adequate blood supply. And what could happen, new, smaller, fragile vessels could start growing, and they can break. And then you got a mess on your hands. Okay. Well, with this individual, this affects the lid. She comes in, all of a sudden, my lid is drooping. She has myasthenia gravis, which is a demyelination neurological disease where the wrapping of the nerve fiber is the myelin, which wraps around the nerve, is just falling off, and it causes muscle weakness. So we send her to a neurologist, and he takes care of, he makes the definitive diagnosis, and she gets treatment, and she'll do well. Next. Go back to the optic nerve just for a minute. That's a healthy optic nerve. See how pinkish orange it is? That's what a healthy optic nerve looks like. In the little smaller center, that's what the cup's supposed to look like. Now let's go to this next one. What's the difference? It's snowflake, it's chalky white. That means that the nerve is dead. It is dying. That's what atrophy means. And this individual has multiple sclerosis, which is another neurological disease. And she was diagnosed from coming to have, her vision went out. And so this prompted her to come see us. And we see this, and she needs to go to the neurologist also. Next. That little center white thing there, that is a cataract. That is called a posterior subcapsular cataract, and it's secondary to systemic steroid treatment. So you have people with all kinds of ailments that are on steroids, and you say, well, if you know the steroid's gonna cause that, why put them on that? Because it's better to have the cataract than to be dead. So we can fix this. The good outweighs the bad, so we don't have to be afraid to treat them with corticosteroids, because you can handle the elevated intraocular pressure, or you can handle the cataracts, and they get better when you treat them. And this is why I say that optometry is not a standalone entity, because the primary care physician or the rheumatologist or whoever the specialist is treating her sends her to me for me to manage the ocular side effects. Next. This was one of my favorite cases. It turned out good for the patient, but pituitary tumors. Patient had headaches, vision loss. They have a visual defect, and that's very important. And when they come in, it's not exactly like this. This patient came, this is one of my church members. He came in and he said, Doc Sam, I'm bumping into things. It's something wrong with my vision. And my wife said, I am meaner than a copperhead snake. I cry all the time, and I just don't know what's wrong with me. So we did an eye exam, and let's just say he was slightly nearsighted. Let's just say I prescribed him some new glasses. I had him seeing 20/20, and I just forgot about the other stuff. I really didn't do my job, because I didn't fix the problem. He said that he has headaches, he's bumping into things, and all of those are bad omens that you really need to look into. So go to the next slide. I have this picture of the brain turned upside down so you can see what I'm talking about. The pituitary gland sits up under where the optic nerve, which is the nerve to the eye, where the nerve fibers cross. And if there's a tumor, it's pushing upward, it's placing pressure on the nerve. Therefore, when the nerve fibers cross, the crossing fibers project. There are nerve fibers from the right eye that go to the left eye, and vice versa. So if they can't cross, that makes the patient have what we call, you can go to the next slide, a bitemporal hemianopsia, meaning half their temporal vision on both sides is gone, and that is textbook. That's textbooks for that. So what happened is we do all the proper tests, appropriate tests we're supposed to do, send him back to his internist who has an MRI done, and there it was. So we send him off to the neurosurgeon. The neurosurgeon goes in through the nose and takes out the pituitary tumor. His visual field comes back. His hormone level is straight again. He's a nice person again. His wife liking him again, and it worked out good. Most of these are benign, and most of the ones that I've seen were benign, except for my 17-year-old patient. But he had another type of brain tumor, but he died. most of them have very good turnout. Okay, next. It looks like you guys gonna get a break. I didn't think this was gonna, I thought this would have gone much longer than this. But anyway, I have something, an interesting situation for you, and I need somebody to just chime in if you know what's going on. So we have a patient that came in. They were seeing double. Their lids were drooping, and so here's the thing. The lid was completely closed. But when I raised the lid and asked them, and we looked at their vision was pretty good. There's two situations here. And they had a history of diabetes and hypertension. So there are two cases here, and we need to decide which one was an emergency. One of the cases, the pupil was affected, where it was not reacted to light. And as a matter of fact, the pupil got even smaller when it was in dim lighting. In the other eye, in the other patient, when we checked the pupil was normal. So I asked you which one, and we know both of these are from the third nerve. The third nerve controls the medial rectus muscle and the lid. So I asked you which one would be emergency. You can think about it, and we're going to talk about it Friday. Actually, the one that was where the pupil was reacted to light is not an emergency, because that is secondary to diabetes. The other one, the patient could be at the verge of an impending stroke, or they could have a brain tumor. So that one was an emergency. And so we sent that one to the ER immediately. So you can go to the next slide. Wow, we had the conclusion that fast. Well, if you remember our objective, we said that optometry was not a standalone profession, that it was tied to all the other healthcare specialists. And since the eye was not a standalone organ, same things affect the rest of the body, affects the eye also. And thirdly, the optometrist, like we said, plays a role in the total care of his patients. And we did this exercise because I wanted you all to get the take-home message that optometry was more than just eyeglasses and contact lens. And I think I've proven that with the presentations, the cases that I've shown you. Actually, that's the total reason that I chose optometry, because in the beginning, I knew nothing about optometry, and I thought that I didn't even look at it because I didn't think they were doctors. I didn't think they did all of these things until I actually did my research and did some shadowing, and lo and behold, it satisfied what I wanted to do. So, are there any questions? Is it normal to be nearsighted in only one eye? It happens. That's not the way it normally is, but it happens. Most people are sort of equal in each eye, but it's not the ideal way. You don't want that, because especially if you're a child, really young, because if it's not corrected in time, then you end up with a lazy eye. And a lazy eye is decreased vision in one eye over the other eye in the absence of any eye disease or trauma. So that is why it is important to have an eye exam at a young age. Because as if you're a youngster, you don't know what clear vision is. You don't know what you're supposed to be seeing. And those of you who wear glasses, you can vouch for that. Is it a way to correct a lazy eye? Yes, it is. It has to be caught early, because early on the visual system is very pliable, and you could teach it to do new things. Could you please tell us more about your eyewear business? Such as, well, we have a full service optical. Patients can leave our exam area and go to the optical, and we have designer frames. We have in the middle frames, we have budget frames. We prescribe and sell contact lens also, but we do some other things too. I do what we call low vision treatment. I am a -7 in my left eye and a -5/5 in my right eye. How does that happen? Nature did it. You know, but I bet you wore correction as a small child, because that didn't just happen. Do you have good vision in both eyes?
Dr. Simon, I have a question.
Go for it.
Can you force yourself upon wearing glasses, like at a young age? Say you were one of the kids and used to put on other people's glasses and be like, can I see out your glasses? Can I see? Can that force you to become somebody that wears glasses?
No.
It can't. So that can't mess up your vision, actually.
No.
Okay.
It can give you a headache. It give you a great headache.
That was what they used to say to us when we were kids. If you wore somebody else's glasses, it'd ruin your eyes. Is that what you're talking about?
Yes.
Yeah.
Yes.
That used to scare us when we were kids.
That was a question. Is there anything specific you can do to take care of your eyes? Well, when you're doing your work and when you're reading, use really good, adequate light. We've had patients do dumb things, like when there was an eclipse, without the proper eyewear, you're sitting up there gazing at the eclipse. Didn't make no sense at all. That's how you ruin your retina.
Dr. Simon, you're defunking everything that my mother taught me.
How is that?
Exactly what Augustine was saying. She told me that my eyes were going to be ruined by wearing someone else's glasses.
If it wasn't your prescription, you couldn't see well out of it.
No, not at all.
It's crazy because I always thought that would be like a real reason. It's like something that just clicks in here. Like, this might mess up my eyes a little. They say it mess up the nerves in your eye. I don't think so.
No, that's not true. Nature fixes it. Let's see, would you recommend people to wear contacts or glasses more, or is it the patient's preference? For me, I'm so thankful that I don't have a real big spectacle correction. Correction, because I would be jacked up, because I don't do well with contact lenses. I think it's just a preference. For example, if you are an athlete, you could wear sports goggles, but then they fog up, especially if you're a football player. You put that helmet on and you fog up, and contact lens has its advantages. Is vision hereditary? Yes, it is. Yes, it can be. Then goggles, the goggles are ugly. I don't know, some people think they're kind of fashionable, but contact lenses are more flexible. You can do other things with them. Let's see. I recommend getting both. I wear contacts during the day, and I like that. That's exactly, I like that. They said that they have both. They wear the contacts during the day and the glasses later on. That'll work.
Here's another old wives' tale as well from when we were kids. We were told if we watched the TV too much, our eyes would get square.
Well, I mean, if you, the thing is, prolonged accommodation, that means focusing up near. You could do that so long that the focusing system don't want to let go when it's time to not. My left eye is worse vision than my right. Is that a common trait? Some people have a higher prescription, a poor vision in one eye over the other. However, the trick is when you have proper correction, are you 20/20 then? That's what really counts. It doesn't matter without the glasses because that's the whole purpose of wearing glasses. So, very good. Let's see. Since we're students, wait a minute, I think I have a perfect vision until I put my glasses on. Don't know if you already mentioned this, but can you mess up your eyes by being too close to the screen? It can cause your eyes to be uncomfortable. It can cause your eyes to hurt. And the truth, it can exacerbate your nearsightedness.
Dr. Simon,
Yeah,
there's something about blue filter glasses or something for, I guess, the blue light that comes off screens. Is there any reason whether that helps or doesn't?
Well, it does, but what we recommend to most of our patients is the anti-reflective coating. Now, that's the way to go. Like the reflections from the lights at night from the computers, that works really well.
Okay.
Let's see.
Who
Who performs laser surgery? What would that be? An optometrist? Different. My partner would be the ophthalmologist does laser surgery. For you, I assume you're talking about laser surgery for nearsightedness or farsightedness. But yes, my partner, the ophthalmologist, would do that. When you close your eyes and you can see colors. You would ask me that vision science question. Olivia gonna tell you that answer. Because you just had it. Didn't you just have Dr. Luke?
Yeah, I did, but that class.
No. I'm the director of student affairs, and I want you to answer that question.
Dr. Simon.
That is horrible to put someone on the spot like that.
You don't have to answer that.
I don't know that one. I don't know that one. When you close your eyes, you can see colors.
I'll give it to you Friday. I've been out of that so long.
What about the
Yes.
silver things? The silver things that shoot when you see, like when you sneeze and you start seeing the little silver bugs?
The floaters?
Pressure
That's
pressure and to increase the pressure.
yeah, but those could be vitreous floaters. The vitreous is the jelly part of the eye. It gives the eye its shape, and little pieces of matter breaks off and is floating in the vitreous, and it casts a shadow on the retina, and you perceive it as a spot, silver thing. Next question. You know what? I should have brought you all some of those optical illusions. They're pretty cool. What does it mean when your eyes turn? I thought I was the only one that saw those things. All right, that was a question, Dr. McNichol. That was not this last one. It was another question. Whoever wrote that question, would you put it back up?
Which one are you talking about? Sorry.
Not the last one, the one before.
What does it mean when your eyes turn red from looking at a screen? That one? Or
No, that's just eye ear overexertion of your eyes.
with a possible virtual fall 2020 constant online classes and screen time, how do you recommend we not strain our eyes?
Well, you should take breaks. You should blink. You should blink regularly and just get up and take a break. Just a 5-minute break. I'm not saying go and watch a football game or something like that. Just take a brief break. Yeah, that's the way to do that. Or just look away. What does it mean when does the eating? Oh, interesting one. Does eating carrots make your vision sharper?
Yes.
Who said that?
Carolyn.
No, because in our country, in third world countries, they don't get enough adequate vitamin A and all the nutrients. Yes, that would be helpful, but even the worst diet in the United States, you get adequate nutrients to where that wouldn't happen.
My mother is not going to be happy with you, Dr. Simon.
That likewise mine. That's the stuff they used to tell us. Eat your carrots, and they're
Yeah.
not.
So.
Was there another question that didn't get? Guys, you can unmute yourself if you. I'm trying to track back through the questions. If your question didn't get answered, just unmute yourself.
Yeah, I got a question. Because sometimes when I go like to the eye doctor, they give me like a week-long prescription, but I wear them for like 2 months. Is that bad? For the contacts.
So you one of those perpetrators that do nasty stuff like that, just wear the now. Okay, so you wear them for how long?
For like 2 months.
Oh.
Okay, you know what? We are all adults here, so I'm just gonna ask you: would you wear the same underwear for 2 months?
Nah.
No, I'm just saying that is not good, and you know it's not. But now, okay, why don't you do it this way? They have contacts that you can wear for a month. Why don't you get them instead of that? You know what?
I got them right here, but I haven't put them on yet.
I wished I had been thinking of one of the things I should have put in there of the cornea, a corneal ulcer. My neighbor had a huge one. I mean, if we hadn't have done something that day, he would have been blind. He would have been done. Because I called my partner, ophthalmologist. I said, I took a picture of it and sent it. He said, "Are you on your way to the hospital?" It was just that bad. So all you need is one ulcer. It'll teach you. You just need one time. One time. You don't want to go down that road one time. So
I have a question.
yes.
So back to like what he was saying, say I have like contacts that are good for a month, but I use them more than a month, but what if I don't use them every day? Is that okay?
Are they just sitting in solution?
Yeah, like I rinse them off, like, change out the solution, but I don't wear them for like a month straight.
Yeah, I guess. But as long as they're not sitting in that same solution.
Okay.
But like I said, the longer they sit there, like someone said, you're prone to get an eye infection because nastiness start growing in there. But that's better than wearing like Javier.
You should come into my lab and we'll grow an agar plate and grow some of the little bugs that are growing in that solution. I'm sure we could some good stuff.
So, Carmen, Dr. McNichol, you grow stuff in your lab.
Well, I grow cells and we get contaminations, so We can see what nasty stuff can grow, but we could grow it out on an agar plate and
Well, that's what I'm saying.
I'm just guessing. I don't know. I'm not done it.
I actually have a little project for us. Just a small project. I just didn't have the way of growing stuff. So anyway, we're trying to use a different sanitizing little gadget that puts out ozone O3 O3 gas, and it is claimed to kill 99% of what grows.
Oh.
So
now you
so
could do an imprint of your instrument on an agar plate and see if it's true.
yeah, that's exactly what I want to do.
Oh, you're right.
Okay, guys, what's the next? I really hate we didn't get to do that little exercise. You guys,
Dr. Simon?
I can tell. Yes.
I have a question. So when you sleep in I don't know if you've ever slept in your contacts before, but like when you wake up.
Where
like,
are you? Let's see. I
right
don't
here.
see. Go ahead.
Blackhead band? Yeah, hi.
Okay.
When you sleep in your contacts and then you wake up, like your eyes are like filmed shut, and then like when you go look in the mirror, you have like little like it's like a
little nastiness.
Yeah, what is that?
Well, now when you slept in your contacts, the eyes become dry, and it produces mucus to try in an attempt to moisturize the eye. So if you're gonna sleep in your contacts, first thing you ought to do before you sleep in them is to put in re-wearing drops. And
Okay.
that should be the first thing you do when you wake up, is put in the re-wearing drops. What you shouldn't do as soon as you wake up is try to take the contacts out, because remember, if they're dry, they're stuck to the front of your eye, and you can bring a piece of the cornea with you and you're not gonna have a good day.
Yeah, once like my contact, like I slept in it, and you know when you close your eyes roll back, and how your contact stays on your eye. So like I had to like pull my lid forward and like reach back and get it. Yeah, I never did that again.
Because you think they're gonna go up in your brain or something.
Yeah, I got scared.
They can't go anywhere. That's what. No, they can't go nowhere.
Like I had to reach back and get it.
Well, it could have gotten stuck under your lid, but it can't go any further than that. Someone asked, how often should you get an eye exam? That depends. If you got normal vision, you guys are young. Every 1 or 2 years is good for you guys. But those that wear glasses have refractive change. I like to see my patients every year. And then people that have other things going on, systemic problem, they're seen more often.
So we've got a question about the twitching eyelids.
No twitching eyelids. The book says that's 99.9% nerves. Every now and then, never seen this. The whole time been practicing 35 years, never seen this. It could be related to maybe a lesion in the brain, but that's not it. 99% of the time it is nerves or stress.
Spontaneous depolarization of those.
Yep. There you go. See, Dr. McNicholas, she teaches physiology and all that good stuff. But it's not. What else? When I don't get sleep, my eyes twitch. That's stress, and that's lack of sleep.
Well, I got another question.
Okay.
One time I slept over in my friend's dorm, like at school, and he had no, like, I didn't want to go back to my dorm, so I just like slept in my contacts. What's worse, sleeping in my contacts or like taking off my contacts, getting like a bottle cap of water and putting like solution in there? Which one's better?
Wait a minute, you did what? You put what?
I took off my contacts, grabbed like a water bottle, like a cap for the water bottle, and I flipped it over and just put solution in there and my contact.
What kind of solution he poured in it?
I forgot now. I could bring it out.
Okay, well let me ask, did you run hot water over the cap? Did you sterilize the cap?
No.
No.
Can you use water as solution?
Does water have preservative in it?
Gus, no.
No.
But it's just one of them things you be like, oh, I ain't got nothing to put. All right, say I'm out and about and my contact come out. I can't go get some water and just
Water
rinse
can evaporate. No.
Well, I mean, well,
If it's tap water, it can carry antimicrobial too.
yeah, that's right. Water, you can get some nasty stuff. I mean, because the water is not pure. It's not purified. You opening the door to, I almost would probably throw that contact away. But I get, I mean, you just have to roll the dice and just see what happens. I've had other folks tell me they put it in their mouth and until they got where they were going. That is the filthiest place you get. I mean, it's the truth. That's what they did.
The filthiest place in the world.
Yes.
Dr. Simon, did you
Yes.
see, do you know who Draymond Green is on the Golden State Warriors?
I just saw Draymond about an hour ago on ESPN.
He was playing a game and he dropped his contact lens on the game floor where everybody runs with their shoes. And he put it back in his eye. That is so nasty.
It is. I actually have seen guys do that. But most of the time they go over to the trainer and the trainer rinses it off. Most of the time. But I've had friends that wear a hard contact lens and they got in a situation and they put it in their mouth and then put it back in their eye.
So Javier, you're saying you did that before? You dropped it on the floor and then put it in your eye?
Yeah, it was like
You have no respect for your eyes, mate. None whatsoever.
I'm telling you, and once they're gone, you'll be feeling some kind of way about it. I mean, so
Wow.
that is messed up. You need to take care of them. I mean, most of what we learn come from our vision. I promise you, if I had to lose one of my organs, my special sensory, I don't want it to be the eye. I could lose hearing in one ear. I just won't be in stereo. I mean, but I don't want to lose I would not want to lose my sight.
So if we're going for prizes in this course, you win the prize for the person that does not respect their eyes enough, Javier. Seriously.
Who playing in the background?
I have been wondering that too.
LA Sparks and the Minnesota somebodies. It's just on for background stuff.
Dr. Simon always has sports going in the background.
Always.
Always.
Well,
always.
see, in between patients, you can come and take a look. See, I can't do that at the school. Oh, the links. Oh, thank you. See, I don't keep up with them that much, but I did a new case. Okay.
Dr. Simon, you have another question. I lost the top to one of my contact cases and just had solution in the pot. And when I put the contact back in my eye, it burned. Why was that?
Probably because some things done got in there without the top being on. That's why your solution probably was contaminated. Like I said, all you need to have is one mishap and it teaches you a very valuable, I don't know though, because I got a couple of patients, they get jacked up all the time, but they don't learn. For me, if I had a real high prescription, I'm gonna have LASIK.
All right, so I have a question. Why did you get into optometry knowing because you're not a person that wears glasses or contacts, so what made you say, let me do optometry?
Okay. From age 5, I always wanted to be a doctor, but did not know about optometry. Nobody in our family wore glasses. And when you were in school, and there was never, this is strange. In our class, there was hardly, in grade school, there was hardly anybody at the school wearing glasses. They probably should have worn glasses, but there would be one guy that would have these real thick glasses on, or a girl, but nobody else wore it. So we knew nothing about that. I didn't know anything about, I'll answer that in just a minute. I didn't know anything about optometry until my senior year in college. I majored in nuclear medicine technology, and I got a chance to, through nuclear medicine technology, I got a chance to experience all the health profession. And I just got to a point, and actually the cool part about it, I could have gone in any of the directions. I got accepted in Georgia Tech in their health physics nuclear engineering program, but didn't want to do that because I didn't want to work around radiation anymore. I just decided I wanted to go to school 4 more years, but I still wanted to be that doctor that took care of their patients. And at first, I didn't know nothing about optometry. There was nobody that looked like me that was doing optometry. There was a girl in my micro class was majoring in optometry, and I said, wait a minute, let me take a look at this optometry thing. And it was way more than what I thought it was. And UAB was the #1 optometry school in the country. And so home court advantage, and here I am 35 years later. Now, if you'd have told me I'd have been on faculty, I would have told you were smoking some kind of stuff. I really didn't see that happening, but.
I'm glad I turned the camera off right before you said that. I'm gonna post this, you know.
But anyway, that's how I got to you. But it was the best. It was the best choice I could have made. Being on faculty with great folks like Dr. McNichols, that was the best thing that I could have done. I graduated 750 doctors. Now, when I took over Director of Student Affairs 16 years ago, that's how many I graduated. So I'm going for 1,000. And
then you're retiring. Is that what you're trying to say?
I didn't say that, but I do know I need a couple of you all on this Zoom in my class. It works because we accepted 2 from the 2018 class. Hopefully we're gonna accept a couple from the 2019 class, and then hopefully we're gonna accept a couple from the 2020 class. So,
he means it, y'all.
So, you know, yeah.
Amar,
so next, go ahead.
Yes, Amar.
Oh, Amar asked, what?
Why do your eyes?
Oh, why do they itch? Lots of reasons. They could be dry. You could have eye allergies, or you could have come in contact with something that your eyes really didn't like, which would be an acute allergic reaction. But for those things, generally antihistamines works really well with them. And if you need to pull out the big guns, the steroids work well also. Do you think
people want to know where you went to undergrad at?
UAB.
Oh.
Blazer to the day I die. Somebody just asked, is the University of Houston a good optometry school? Yes, it is. It's a very good optometry school. Very, very good. I know all the players down there too. Actually, the dean there was he was on faculty at UAB. He was one of the associate deans at UAB last year. Very good.
Awesome. Any more questions? It's been a good chat.
That's in state for me. Out of state for UAB is so expensive. How do you know that?
Ooh.
I looked it up, and
You looked up what?
Well, because I'm from Houston, and when I compare, like I went on a website the other day and I compared the tuitions, and in-state for U of H is a lot cheaper than out-of-state for UAB for me. So like those are my top two choices. So I'm
Well,
just,
how do you know you're not gonna get a scholarship?
Bam.
Just saying.
well,
Well,
To existence.
Perhaps you
I'm gonna just mute myself.
perhaps you need to have a little conversation with me, a little side conversation.
Okay.
Are you in the optometry cohort?
Yes, sir.
Oh, we're gonna have a conversation anyway. And besides, but it makes it, if UAH it works better for you, it's still my job to help you get there. So we're gonna have a conversation. I know all actually the funny thing, I just got off a Zoom with them. I'll tell you who you need to contact and all that good stuff. That's what our program, that's what this SHPEP program is for.
Thank you.
You're welcome. All right. You guys asked 9-8 questions. That really good stuff. But guess what? Now Friday, you guys gonna get to play doctor. Y'all gonna be the doctor. And I'm gonna be the patient. So you all gonna have to heal me. Sometime I'm gonna have a systemic problem. And sometime I'm gonna just have eye problems.
actually, that's a good segue into just reminding everyone of the group. So on Friday and tomorrow, actually for the next few days, you're going to be divided into groups. If I can just take a minute to kind of remind everyone. So there's two versions of groups going around. There's your candy groups, and the form that's on the website looks like this with the green.
Dr. McNichols.
Yeah.
I'm gonna go ahead and leave. I got a patient I gotta see. So
okay, sorry.
That's all right. We'll get together Friday, guys. See you.
Thank you. Bye.
Thanks, Dr.
Bye.
Simon. I'll just let me stop recording here.